I completed my graduate work at the University of California in Davis, and I have clinical experience with moms and babies over the last 20 years. I'm an internationally board certified lactation consultant and first received my board certification in 1992. My particular area of specialty is maternal infant nutrition, and because I'm so interested in what moms and babies eat, I decided to look at how we are feeding babies and what happens to nutrients when we use different types of bottle systems. We started with baseline measurements and then took measurements every 5 minutes. We adjusted the pumps that we used to extract the milk from the bottles so that it had a consistent amount of flow, and again to mimic what the infant does when the infant takes milk from a bottle. A lot of this information is available in food science, it just hasn't been applied to baby milks before. So this isn't something brand new, the idea that air will cause degradation of vitamin C. That's been known for quite some time. It just hasn't been applied to baby milks. Because we used pooled human milk, we standardized the level of vitamin C in the milk before we began the study, and that level was standardized at 42 milligrams per liter. For this particular study, we chose 7 commonly available bottles, and some of those are what are considered traditional bottles, and some were the vented bottles. What I discovered is that there was only one that actually was fully vented. By that I mean that no air moved through the milk. The procedures are completely documented and well validated in the research literature. The techniques are not new that were used, it just hadn't been applied to this particular situation before. And by using procedures that are already validated, it helps ensure that the research is repeatable. And I feel confident that were someone to use the exact method, they could reproduce the study. The research was completed by a team or a group of researchers, and all of the testing was completed in triplicate. The idea behind doing testing in triplicate is so that it becomes repeatable. Part of doing good science is that it needs to be repeatable by someone else. And by doing things in triplicate, the research team can ensure that were someone else to do the study, they would come up with the same kind of results. I think that this research is very important because we need to look at how we're feeding babies. And more moms are expressing their milk and storing it for later use to feed babies. And as that happens, we need to look at the best way possible for delivering that milk back. Vitamin C is an essential nutrient that is critical for growth and health. And babies are growing very rapidly, so it's important that they get an adequate amount of vitamin C. Vitamin C is critical for infant growth and health. It's part of collagen. Collagen is the connective tissue that holds the body together. It helps in the formation of bone and blood vessels. It helps in the formation of teeth and holding those teeth into the gums. It also helps in immune function. And those people who have low levels of vitamin C tend to have more colds, they get viruses more easily, and have more illness. Depending upon the bottle system that was being used, the loss dropped as much as down to 10% of that 42 milligrams per liter. So significantly below what the recommended daily intake should be. And it's clinically important because if an infant is relying solely on the milk that they're taking in through a bottle, and there is that kind of vitamin C loss, they're high risk for vitamin C deficiency. I think that as healthcare professionals, we have a responsibility to parents to provide them with an adequate amount of information so that they can make good choices for nutrition for their infants. Parents need to be aware that loss of vitamin C can occur so that they can make choices that will help ensure that their infant gets the most nutrients possible from the food that they're taking in. Parents should certainly look for a fully vented bottle. look to see if any air is forming bubbles through the milk. If the air is moving through the milk, there would be loss of vitamin C.